Okay, so picking up where we left off on Monday, we have to finish talking about the ethmoid bone, the inferior nasal conchae, and then the vomer, which I guess we did talk about the vomer. We learned that it is one half of the nasal septum. Remember, the nasal septum is the wall that divides our nasal cavity into its left and right sides. Okay. We colored it black, okay, and then looks like we colored the ethmoid bone, but we didn't really talk about the ethmoid bone from what I'm remembering, okay. The ethmoid bone, here's what it looks like in an anterior view taken out of the body, so it's kind of a funky looking bone. It is, remember, a cranial bone, so it does form a portion of our cranial floor, as you can see here, and that's why I included this image looking down at the bottom of our cranial cavity. Okay, I was going to think of it like a lowercase t, okay, where it's got a vertical line and a horizontal line. We call these plates. Okay? A perpendicular plate is the vertical plate. Cribriform is the horizontal plate. So what we colored last time when we're talking about as far as the nasal septum goes, is the perpendicular plate of the ethmoid, okay? So that would be what this is here in our image there, looking in the middle of the nose, okay? The perpendicular plate helps create the rest of that nasal septum, okay? The horizontal plate, it's called the cribriform plate. I'm kind of outlining it with my pen here. Cribriform plate. And if you can't read my handwriting, that's it right there. This is the horizontal portion, so it would be like this portion of our T, and it forms the roof of our nasal cavity. So you can kind of think of your ethmoid as doing this to our nose, which you guys all can look at me and see. It vertically separates nose into the two sides, and then it also creates the roof of our nasal cavity, okay? Now, extending off of it, a little point, to me always kind of looks like a rhinoceros horn, okay, is what we call a cristagalli. It's this little triangular shaped region, okay? And this afternoon, when we have lab in here, you guys will have opportunity to look at skulls and see this when you look down in this cranial floor, okay? The cristagalli is not labeled, but it would be right here. It helps divide some kind of stuff associated with the brain into the two sides, because your brain sits right on top of that cribriform plate, okay? Now what's really cool is there's nerves right above that rest there, what we call the olfactory nerves, okay? They have little extensions, neurons that run through tiny little holes called olfactory foramina, which are described right here, okay? That allow neurons to penetrate into our nasal cavity so that, they can be stimulated by the things that we smell. We'll talk more about the nose here in a couple weeks when we talk about smell and other sensations. So we'll kind of see some of these things here again. Okay. Other things associated with the ethmoid. And the main reason I included this image is to show these what we call ethmoidal cells, or ethmoidal air cells, ethmoidal sinuses, little pockets, and this is why it looks kind of like a sponge, okay, which are tiny little sinuses that connect to our nasal cavity, like right between our eyes. So if you ever feel like, we talked about how like the frontal sinuses, you get pressure in your forehead. You ever feel like somebody's just like pinching between your eyes when you get sick? Okay, it's probably these that are getting clogged up. And The last thing I want to talk about associated with the ethmoid are these little hook-like structures, which we call nasal conchae. Okay? The superior nasal conchae, concha, without the E at the end, is a singular form. They're only labeling one, but there's two of them. Middle are part of the ethmoid, and it looks like I did not color those last time. So I apologize. I'll color them now. Are these little hook-like structures in the internal nose? Okay. Notice here we have letter N. Those are separate bones, the inferior nasal conchae, which we'll color here in just a second. Okay. The function of these little hook-like structures is to create these little passageways. So places like here and here. It's not just a big opening from the external nose into your throat. Okay. These little openings are called meatuses, the little passageways for air. And they are going to help warm, moisten, and kind of filter the air as it passes through our nose towards our lungs. Okay, because we don't want cold, dry air getting into our lungs. That's not, a good thing. So the superior and middle nasal conchae are part of your ethmoid. Then I will color the inferior nasal conchae pink, which is like the letter E got cut off here. Not a bone, it's a bone. Okay. Actually, there are two bones. Okay. That's what we see here at the bottom of this picture. But more importantly, we see them over there. Letter N. Okay, any questions on those? Okay, those are all internal nose bones. On this next page, we'll talk about some of the external nose bones, your nasal bones, along with some other facial bones. Now, one good thing about facial bones is some of them, you really just have to be able to identify the bones themselves. There are, like the maxilla and the mandible, that have a lot going on with them. But for like the palatines, you just have to identify them. Lacrimals, there's one other thing to talk about. Nasals, that's all you need to know. Okay, color coding it. I'll go orange for the maxilla, blue for the palatines, yellow for the zygomatics, pink for the lacrimals, and this kind of green color for the nasals. I actually started at the bottom because those are super simple. I'll actually work it up. So in our anterior view, nasal bones form the bridge of your nose up there between your eyes. Like I told you guys the other day, a lot of times when people break their nose, actually they're not breaking these, they're damaging their nasal septum. Okay. Now we can see it down here in our median section. I'm not going to even color them there. That's not why I included that picture. And that's all you need to know for your nasal bones. Super simple. Just be able to identify them. Okay. The next two bones I'm going to color are the lacrimals. These are very small bones, intermedial orbit. And we can see them nicely here in our lateral view, like so. Now, there is one thing to identify in them. I'm kind of darken it in. It says fossa for lacrimal sac. I just call it the lacrimal fossa. This is a depression that holds a structure called a lacrimal sac, which collects tears from our eyes because we produce tears. Actually, there's a gland right here that come down, and the tears come over here if they don't fall down our cheeks. Okay, and connected to that fossa is what we call nasolacrimal duct that carries those tears into our nasal cavity. And this explains why, if you cry, your nose runs. You're literally crying also through your nose, which is kind of weird. But that's a washing mechanism, kind of cleans things out. This gets stuff out of it. Okay, your zygomatics are the cheekbones. Very nicely shown here in our lateral view. As well as our anterior view. Now they form our cheeks. They're also going to contribute to our lateral eye socket. We can see them down here in this picture, but I'm not going to color them. That's not why I included that picture. Okay, last time we met, we talked about the temporal bone, and we discussed that bridge called the zygomatic process. Okay. Here's something that's really kind of weird. This bridge here is called the zygomatic process of the temporal bone because it connects to the zygomatic bone. Right here, this little triangular shaped region is called the temporal process. Temporal process, you can't read my handwriting, articulates with that zygomatic process. So this is where we form that joint between the two. They name them for who they connect to. Instead of naming it zygomatic process on the zygomatic bone, temporal process on the temporal bone, they name them flip-flop. Probably just to confuse anatomy students. Yes, ma'am.
Is the reason your temple, like your bone, is like a bad place to get hit because all of those connect right there?
So, like your temple would be like right here. They said that's one of the softest parts of the skull. I don't really know exactly the reason why. I know why it feels soft because there's a muscle, and it's kind of indented here. So there's muscle right in here. As far as why it's susceptible to getting hit there, I don't really know the specifics. Good question. I just don't know the answer. Okay, palatine bones. Palatine bones help form the roof of our mouth. And that's why I included this bottom image on the left. The palatine bones are letter K. You can't see the letters, but that's okay. I'll show you where they are. They're also, one of them anyway, visible over here. About the back third of our, what we call hard palate. Okay. Now these actually also contribute to our eye socket. It's so small, I'm not even going to try to color it in here. It's kind of cool. That's all you need to know for those bones. The majority of your hard palate, you can see I haven't colored yet, but I'm coloring it right now as I speak. Formed by your upper jaws, what we call the maxilla. Maxillae. Maxillae, I've heard them pronounced. Now, that would also be out here. I'm just going to focus really on the roof of the mouth here. These contribute to our cheeks a little bit as well as our eye sockets, our orbits. Okay, structures associated with these bones include hole on each side, or each bone, because there's two of them, called an infraorbital foramen. Last time we talked about the supraorbital foramen in our frontal bone, both of them, that is. We said supra referred to superior, so what does infra mean? Inferior, very good. Kind of in that same general area, we have a couple more sinuses, what we call the maxillary sinuses, large cavities that empty into the nasal cavity. I don't have a picture for those, but I promise you they are there. So if you feel like you get sinus pressure kind of more in like your cheek area, below your eyes, it's more likely your maxillary sinus is giving offense. Yeah. Last thing I want to talk about are associated with our teeth, because our maxilla bones and our mandible have teeth inserted into them. The sockets our teeth are inserted into are called alveoli. Alveoli is plural. Alveolus is singular. Okay. There's also, and it's not labeled, so I kind of just draw it in as a subtle line here, what we call an alveolar process. Alveolar process, just the kind of bridge that comes across that supports our teeth. Okay, any questions on these bones? All right, last bone of your face is our mandible. Very big, strong, only movable bone in our skull. It's very complicated. So what I've done is I've included a, mandible on its own. And then at the bottom, we've got our anterior and lateral views that we've seen just about every page here. Your lower jaw, it's a singular bone, whereas our upper jaws, the maxilla, were two bones. Okay, first thing I want to talk about are what we call the body, the angle, and the ramus. They're kind of three distinct regions to the bone. The body is, what essentially comes together to form our cheek, or our chin, excuse me. It's the horizontal portion that supports our teeth. The ramus is the oblique posterior portion that projects upwards to connect to our temporal bone. And then the angle is where those kind of two meet. In other words, it's where they angle. Hence the name angle. Okay, first thing I want to talk about, listed there under the angle, are the little holes in your chin, each of which is called a mental foramen. They didn't label it over here on our lateral view, so I will. Mental is a term that refers to your chin. This allows for blood vessel, nerves, etc. things to travel through. Mental foramen is on the outside. Don't confuse that with the mandibular foramen, which you'd only be able to see if you have the mandible out like this, because it's on the inside. Okay? There's a nerve in there that travels right through there that, like, if you ever have a tooth that needs, filled, like, got a cavity, you have to get a shot to deaden. So when they drill, it doesn't hurt. They try to aim right before that and deaden that nerve so that you are pain-free. Okay. Let's talk about these little knobs at the top of the ramus, what we call the mandibular condyles or condylar processes. I actually like the term mandibular condyles, not condyles. Mandibular condyles, can't read my handwriting, is right there. Oval knobs, and they fit right there with that temporal bone that we talked about to form our TMJ, temporal mandibular joints. Don't confuse the mandibular condyles with the little points here called the coronoid processes, which are points of attachment for your temporalis muscle, that muscle I was talking about the other day. Comes down from our temporal lines to right there. Okay. And then just like what we saw with the maxilla, we have teeth. So we have an alveolar process that's actually labeled this time. The sockets are still there, the alveoli. Can't see the sockets because all the teeth are in place, so we'd have to take a tooth out to see into the socket, which we're not going to do. As far as anything else, like the mandibular notch, don't worry about it. The mental protuberance, don't worry about that. And just what I've starred in the pictures. Any questions? Okay, we're done coloring for this lecture. So I'm going to pull my lecture back up here. Before we move on from the skull, I want to just kind of reiterate some of the things that we talked about. Besides forming our large cranial cavity, our skull also forms several smaller cavities, including our nasal cavity, which we talked about today, the orbits, which we talked about today and last time. Those open to the exterior. And then we also talked about paranasal sinuses today and last time that open up into the nasal cavity. Speaking of the nasal cavity, we'll start with it. It is a space inside the skull divided into right and left sides. That vertical partition is called the nasal septum. Towards the back of your nose, it's formed by the perpendicular plate of the ethmoid and the vomer. And then anteriorly, it's made up of what's called septal cartilage, which is nice and rubbery. And like a piercing could go through it really easily. 7 bones of the skull join to form each orbit or eye socket. Another term for that is orbital cavity, where you find your eyeball and associated structures. There's 3 cranials, your frontal, your sphenoid, the green one, and then this kind of, I don't know, orangish colored ethmoid. And then you've got the facials, which include the zygomatic, the maxilla. If you look really hard, you can see that little blue dot in there. There's your palatine, and then the lacrimal. Okay. At the bottom, we show off the different sinuses, the 2 frontals, the 2 maxillaries I talked about today, and the sphenoid, which we said is kind of in the center of our skull. And then we talked about these today, the little pockets from our ethmoid bone. As far as the images go, I'm not going to worry about you knowing them. You guys, we've talked about them in all the other pictures. You'll know them in there. I only included this slide really because the textbook talks about it. Just to summarize some of those things. All right, let's talk about some bones that are associated with the skull, not skull bones, but are found within your skull. What we call the malleus, the incus, and the stapes, which you should highlight in this picture, showing you kind of the internal features of your ear. Malleus, also known as hammer, incus, also known as anvil, stapes, also known as stirrup, are found within the middle part of our ear, and they transmit sound waves that strike our eardrum and transmit those sound waves to the structure within our ear called the cochlea, where we process that sound and turn them into nerve impulses. This image we will see again, and that's here in a few weeks when we talk about the ear and hearing and that kind of stuff. So we'll wait and learn about everything else at that point. So for now, just know those three bones. Smallest bones in the body, very, very tiny. Very amazing though. Okay, your hyoid is the final bone I want to talk about that's really kind of associated with the skull. And it's not a skull bone, but it's located and articulates with some of our skull bones. A U-shaped bone between our chin and our larynx, so like right up underneath your tongue and behind your chin. It serves for attachment of several muscles controlling our mandible, tongue, and larynx. And it can be described as kind of the only freely movable, or I shouldn't say that, freely floating bone in the body. I mean, it doesn't have a direct contact. It's not touching any other bone. It is not just floating around because it's held in place by things like this ligament here, what we call the thyrohyoid membrane that connects the hyoid to our larynx, our voice box. There's tendons that connect it to muscles like the the hyoglossus muscle that helps move our tongue. But it does help protect the throat. In fact, one of the things that I saw this in a TV show the other day, they were trying to find out the cause of death. It was a murder mystery show or whatever. And they checked to see if this bone had been fractured because the person was strangled to death. So apparently that's something they do, or the show made it up. I don't know. As far as that picture goes, or those pictures go, don't worry about those. Just know a little bit about the hyoid itself. All right, moving on to the vertebral column, also known as your spine, backbone, or spinal column, which makes up about 2/5 of your total height, composed of a series of bones called vertebrae. The letter E at the end of the word tells you we're talking about plural. If it's just vertebra, it'd be one. Function of our vertebral column is to protect the spinal cord, support our head, and serve as a point of attachment for the ribs, pelvic girdle, and muscles. Looking here at this picture, this is a lateral view of our vertebral column. You can see all the normal curvatures, and there are 4 of them, kind of giving the spine a kind of S shape to it, which helps to increase the column's strength, help maintain balance in the upright position, and absorb shocks during walking, and just overall helps protect the vertebrae from fracture. They're all stacked up on one another, straight up and down. It would be a lot of pressure pushing down on the next one all the way down to the very end. And during early development, the number of them is 33, but as we grow up, several of the vertebrae in the sacral and coccygeal regions fuse, leaving us somewhere around the age of 26, or excuse me, 25, 30, somewhere in that neighborhood, with a number of 26, I should say. Okay. And those 26 include 7 cervical, the very smallest, okay, C1 through C7, which are going to be concaved as far as curvature goes, which means they curve towards the anterior, kind of come forward. Then you've got 12 thoracics that get progressively bigger from 1 through 12. We call these T1 through T12. And they are convex in curvature, curving back towards the back of our body. The lumbar curves back towards the front. It's concave. There's 5 of those, L1 through L5. If you notice here, all the way down from C1 to L5, we progressively get bigger. So L5 is the largest vertebrae. Now, you could say the sacrum is bigger, but the sacrum I don't really classify because the sacrum occurs from 5 fused vertebrae. So it's kind of cheating. Okay, there's 5 of them that come together, somewhere around the age of 25, to provide a strong foundation for the pelvic girdle. And then the coccyx, the tailbone, as it's typically known as, fuses around the same time, the 20s to 30, and is made up of 4 original coccygeal vertebrae. Okay, this is what the spine should look like, nice and curved laterally. Here are some examples of abnormal curvatures of the spine. The 2 on the right, we have clinical pictures on the top, and then these are kind of drawings to show them. These are abnormal anterior posterior curvatures, whereas the first one, scoliosis, is an abnormal lateral curvature. Scoliosis is where you can see this lady has terrible scoliosis. Follow her spine, it zigzags up and down. What we want is the green line going straight up and down, nice and straight. And kyphosis, also known as hunchback, because it creates that round shouldered appearance. You can see that. Also, this is common, or this is common in what population? Older people, okay? It is due to an exaggeration of thoracic curvature. And then lordosis or swayback is where the lumbar spine is kind of projecting too far forward. Okay, very common in pregnancy. Okay, women, I should say, they get pregnant, get that big bulge in their belly. A lot of abdominal weight kind of helps pull the spine in that direction. And it also happens when people have just a lot of abdominal fat. And you should be able to identify which abnormal curvatures, which in these images, as well as being able to identify the different things here in this left image. Not the most important image, but I do want you to know it. Now what we're going to do is go on to the next slide and talk about just general features of vertebrae. Okay, and this would be for cervical, thoracic, lumbar. We're not going to talk quite yet about sacrum and coccygeal, despite the fact that they're different. They all share some similarities. And here's what just a normal, and this happens to be a thoracic vertebrae, looks like. Okay, but you would see the same features for the most part in the cervical region and the lumbar region. First thing I want to talk about is the vertebral body, which you'll want to highlight in both of these two images. The massive spongy bone and red bone marrow covered with a thin shell compact bone. This is where our body weight is supported. Okay. Now, to protect the vertebral body from another vertebral body, between them is an intervertebral disc. You guys know what inter means, right? Tell me what it means. Between. So between vertebrae is a pad of cartilage. We'll talk more about that here in just a minute. You want to highlight that though. The vertebral body is always anterior. Posterior, projecting backwards, is a spinous process that you'll want to highlight in both images. The spinous process is going to be what you can actually feel if you palpate or run your fingers down the midline of your back, or if you do it to somebody else, you'll feel little bumps at regular intervals. Okay. Do not confuse the spinous process, which is only singular, with the two transverse processes that you'll want to highlight. Transverse processes project laterally and are important muscle attachment sites. Okay. Between the spinous process and the vertebral body is a hole called a vertebral foramen, which you'll want to highlight. That's where you find, as you can see, the spinal cord. The vertebral foramen should not be confused with an intervertebral foramen. Once again, inter means between. This is a foramen between two vertebrae. It's a little space, which we show right here is where a spinal nerve emerges. Spinal nerves are nerves that come off of our spinal cord. There are 31 pairs of these. We don't show one here, but there would be one coming off in that direction as well. So don't confuse intervertebral foramen with vertebral foramen. Other things that are listed up there include the structures of the vertebral arch, what we call the lamina and pedicle. They're kind of hard to kind of pinpoint and show, so I'm going to kind of skip over those. Let's talk about the articular processes. Remember the word articulate, anytime you see that, in this case articular, which is kind of form of articulate, refers to a joint, okay, where two bones meet. Okay, if we look right here, we see a connection between this vertebrae and this vertebrae below it. Okay. This little bump right here projecting down from this bone is called an inferior articular process. Highlight that. The bump coming up from a vertebrae is called its superior articular process. Now the word facet refers to the space right there, that blue. Don't worry about that. So just highlight superior articular process. If you want, you could draw an arrow right here for that one. You could do the same here. Those are how two vertebrae actually do connect. So once again, make sure you highlight the following. Make sure you didn't forget any of these. Vertebral foramen. Don't worry about the supraarticular process here. Highlight spinous process, transverse process, vertebral body, spinous process down here at the bottom. Over here, superior articular process, intervertebral foramen, intervertebral disc, vertebral body, inferior articular process. Let's talk about the fibrocartilage structure called the intervertebral disc, which is made up of an inner gelatinous nucleus pulposus surrounded by a ring of fibrocartilage called an annulus fibrosus. If you have stress placed on a intervertebral disc, you can herniate it or slip it. If you've ever heard of a slip disc, herniated discs, bulging discs, this is what takes place. The kind of fibrocartilage kind of cracks, and that jelly substance can leak out and end up putting pressure on the spinal cord or a spinal nerve, which can cause pain. Happens very commonly in the lumbar region. A lot of times it's called sciatica. Anybody ever heard that term before? And it can cause like radiating pain down in the legs. Call it sciatica because one of the main nerves in your leg is the sciatic nerve. It's kind of not a great way to describe it because it's not always the sciatic nerve involved. So sciatica is not really a great term, but it's kind of a commonly used term. Not worried about the image at the bottom. I just wanted to kind of show what can happen. Unfortunately, very painful. Thankfully, I've never experienced it. Okay, what we're going to do for the next couple slides is go through the vertebrae region by region, starting with the cervical vertebrae, and then we'll get into thoracic, lumbar, sacrum, coccyx. And each of those distinct regions is unique, and I told you guys the other day, for a lot of bones, there's not a true name for them. Okay, so how many name bones are there in the body? 206, good. You're not, necessarily learning a true name. For most of the vertebrae, we name them T1, which would be thoracic vertebrae 1. L5 would be lumbar 5. Okay. There are two exceptions to that rule. The atlas and the axis, which are special named vertebrae C1 and C2. Here's what your atlas looks like. It looks like no other vertebrae because it has no body and it's got that big old vertebral foramen. The term atlas refers to, I think it's a Greek god called Atlas, who is responsible for holding the world on his shoulders. And this guy doesn't hold the world on his shoulders, he holds the head on his shoulders. This is where your head rests. The occipital bone articulates with this bone to attach our head to our neck. Okay. The axis is what these two pictures are showing from above and from the side. Allows you to shake your head no. It has a special feature called the DENS, which I would highlight, or DENS process, which this projection upwards fits right there in that big space within the atlas and provides a pivot point for our head to rotate when we shake our head no. Okay. So be able to identify in these two pictures that this is the axis and that this is the dens. Be able to identify that this is the atlas. The rest of our vertebrae in the cervical region look like this. And they've got the same features that we just talked about. Vertebral foramen, a small body. Spinous process, a key feature of them is that spinous process is forked. They also have two extra little things, what we call transverse foramina. This extra hole is something you'll want to know. It allows for blood vessels to travel up through our neck to connect to our brain and down from our brain. We'll talk about those later on in the semester. Okay. So on the exam, what I might do is put this picture on the exam and say, what type of vertebrae is this? You would have to identify this as cervical. I might ask you to label the transverse foramen. Okay. Might ask you to label the body, the vertebral foramen, that kind of stuff. I might put this picture and say, what is the name of this vertebrae? You have to say atlas, so on and so forth. Does that make sense? Okay. Now, the vertebrae that was shown on the previous page was actually a thoracic vertebrae. So it looks a lot like what we see at the bottom because it's the exact same picture. For the most part, anyway. Maybe a little bit different. The key with thoracic vertebrae, probably the best way to illustrate them is in the lateral view, because their most prominent feature is a spinous process that projects downward. I've had students tell me in the past that it looks like a giraffe. I don't know. I don't see it, but whatever. Key features of thoracic vertebrae, they're bigger than cervical. They don't have those two extra holes. And they've also got points of attachment for the back part of our ribs. All right, your lumbar region is the biggest, blockiest. Look at them there, but even more so, I've had students tell me they look like a moose. Like I said, I don't see it, but that helps you. Big, blocky. The biggest is L5. L1 is quite large though as well. They don't provide a lot of range of motion. Not a lot of movement takes place with them, but they support a lot of body weight, so that's why they have to be big and boxy. So make sure you can identify them as lumbar, thoracic, cervical. All right, that leaves us with the sacrum and the coccyx. Okay, as far as this image goes, or images, I should say, because there's an anterior view and a posterior view. Coccyx, just note coccyx. So highlight there, brackets for coccyx, that's all you need to know. Okay. The sacrum is quite a bit more complicated. And first thing you need to do is orient yourself anterior or posterior. Because on the exam, I may or may not have it labeled as anterior posterior. But there's an easy way to tell if it's anterior posterior. Okay. Anterior side, right down the middle, is nice and smooth. Whereas the posterior side has kind of a ridge called a median sacral crest that you'll need to highlight. Median sacral crest is only visible in the posterior view. Well, that's important to know because you can see we've got 8 holes. And when we look at them in the anterior view, they are called an anterior sacral foramen, which you'll need to know. Any one of these in the anterior view is an anterior sacral foramen, so there's 8 of them. Okay, if you look at them in the posterior view, it's the same hole, but we label them as a posterior sacral foramen, which you'll want to highlight. Yeah, so over here in the anterior view, highlight anterior sacral foramen. Posterior view, highlight the posterior sacral foramen. Those allow nerves to exit the sacrum, travel down into like our legs. Okay. Over here in the anterior view, highlight the sacral ala, the kind of upper flaring portion of your sacrum. And then over in the posterior view, highlight the sacral canal, which is an opening, kind of like the vertebral foramen. Remember, the vertebral foramen was where the spinal cord is, right? Okay. And this has an opening that actually this canal runs down. It's deep to this, so you can't actually see it. But there's an opening at the bottom that you'll need to highlight called the sacral hiatus. Your spinal cord actually doesn't run through here because your spinal cord actually is ends back up in our lumbar region. What we have though are nerves that run down through this hole. Some of them come out through these holes. What doesn't comes out the bottom through the sacral hiatus. And then the last thing I want to have you highlight is the auricular surface over here on the far right. It's kind of hard to see. You have to kind of turn the sacrum sideways to see it really well. This is a rough area where our hip bones come and connect to our sacrum, forming what's called a sacroiliac joint. Now, this is not the hip joint like you think of that you use when you walk, when you kick, okay? That's between the hip bones and your femur. This is where we connect the sacrum, so your spinal column to your legs, or you could say legs to the spinal column, I guess. That's I joint for short. Okay, one last slide here to talk about the thoracic cage. A series of bones, which include your sternum, which you guys are writing out right now, parts of. And then also the thoracic vertebrae that we just talked about posteriorly, as well as the 12 pairs of ribs, so 24 ribs total. All right, let's start with your sternum, also known as your breastplate. Okay, I've got this kind of black and white photo to show it. It has three parts. The three parts which I want to highlight are the manubrium, which is the upper or superior portion, kind of triangular in shape. The body, which is the skinny, longest, biggest part of your sternum, and then the xiphoid process, which we want to highlight as well. Okay, back up to the manubrium, there's three notches that you'll need to know. One suprasternal notch, which is kind of hard to tell because it's kind of confusing. This would be all the way in the back of your body because that's your first thoracic vertebrae. Okay. This notch you can actually feel. The top of your sternum is a little just kind of U-shaped area called the suprasternal notch. Remember, supra for superior. On both sides of that is a clavicular notch, called a clavicular notch because that's where your clavicle attaches, forming what's called a sternoclavicular joint, SC joint for short. We'll talk more about that next time when we talk about the clavicle. Coming across between the manubrium and the body is an angle. Highlight that, just a line basically. The body I already talked about. The xiphoid process is a kind of point that comes off of your sternum and is an attachment site for muscles of your abs. Something that you want to avoid pushing on if you're giving someone CPR. This is why when you're being instructed to learn CPR, they tell you to find the bottom of the sternum and then go up a couple fingers. So you push on the body because you could actually break that off. And then that might poke through a lung, and not only is the person struggling to breathe, then they've got a hole in their lung, and then they're in big trouble. Okay, ribs. We'll talk about those real quick. There's three classifications for ribs. The first 7 ribs are called true ribs. 7 pairs, I should say. These are Called true ribs because they've got a connection to your sternum. Now, this picture doesn't show it very well. Like right here, the rib actually ends. What connects to our sternum is what we call costal cartilage. Anytime you see the word costal, it refers to ribs. Okay? So ribs 1 through 7 have their own costal cartilage. The rest do not, which includes 8, 9, and 10, which are false ribs. Floating ribs have no connection whatsoever to our sternum. They float. Now, floating ribs are also false, but 8, 9, and 10 are not floating. Does that make sense? So you can be false but not floating, but you can't be floating and not false. Okay. So in this image, make sure you can identify the 3 classifications of ribs. And then everything on the right side of the image. As far as individual ribs, I don't really want to get into those. They're so super complicated with their body, the head, the neck, how they attach to our vertebrae. Here's what rib 1 looks like, which is kind of cool. Kind of looks like somebody's flexing their guns, but I won't worry about the other pictures. So we won't worry about those. Just the big sternum rib picture. Okay, I will see you guys this afternoon for lab in this room.